So patellofemoral disorders are a collection of problems related to the knee, which is that bit of the knee between the kneecap at the front and the underlying thigh bone, the femur, behind. The kneecap normally sits in a groove on the femur, and it forms part of what we call the extensor mechanism, which is basically where the quads muscles at the front of the leg attach through the kneecap onto the tibia underneath, and they're very important. It's a very important structure enabling normal knee function. And what sometimes happens is that either the kneecap is slightly malaligned, so it doesn't track properly, or it can suffer from wear and tear, giving rise to what we call anterior knee pain, so pain at the front of the knee, typically experienced when going up and down stairs, with running, with jumping, certain exercises. So patellofemoral disorders typically present with pain at the front of the knee, which interferes with activities of everyday living, often activities such as going up and down stairs, sometimes getting up from a chair, more impact exercises like running and cycling, and they can be extremely debilitating and interfere with quality of life. So the diagnosis there's many ways to diagnose them. The most important thing is taking an accurate history from a patient and letting them talk to you about exactly where their pain is, because sometimes people just say my knee hurts, but you have to be quite precise on which bit of the knee hurts and what causes the pain. Then clinical examination is important, seeing someone's overall leg alignment, how their knee moves when they bend their knee from the straight position to the fully bent position, but also not forgetting the hip can impact patellofemoral function. And then we do investigations, including x-rays in the form of a skyline view of the kneecap to see exactly how it's sitting in its groove. And then the final investigation is usually an MRI scan to look not only at the kneecap, but also at the tendons connecting it at either end, and the soft tissues, such as a structure called Hoffer's fat pad, which sits beneath the kneecap. So the key to treating patellofemoral disorders is to make sure you have an accurate diagnosis, and that involves the assessment I've already talked about. Once you have a diagnosis, the treatment depends on what you're trying to treat. If it's, for example, Hoffer's fat pad impingement, which is where the fat pad in the knee gets stuck between the patella tendon and a bit of the groove of the lower end of the femur, then treatments such as physiotherapy in the form of patella tracking exercises and iliotibial band, that's the IT band, stretching exercises are usually effective. Occasionally, ultrasound guided cortisone and local anesthetic injections are needed. If someone has quite bad degenerative change in the patellofemoral joint in the form of arthritis, where you have bone on bone wear and tear behind the kneecap, the last resort usually is to do a partial knee replacement in the form of a patellofemoral replacement, and that's normally a robotic assisted procedure. So yeah, lifestyle changes are usually very effective in patellofemoral disorders, and this includes a whole myriad of treatments, including muscle strengthening exercises, and that isn't just the leg, but it's also the whole pelvis and core, so things like Pilates, yoga, that sort of thing, usually very helpful. Sometimes weight is something that can be managed. If you are a bit overweight and you overload your patellofemoral joint, then weight loss is a very effective way to try and make that joint more comfortable. And just general well-being, general fitness is usually very effective in helping the patellofemoral joint, usually in both knees at the same time.